your efforts to take the vaccine. We have had an excellent uptake. We lead the country in vaccination rates for first and second doses, and we're past the 73% mark for first doses for 5 to 11-year-olds. And this has literally changed the face of the risk of hospitalization from Omicron. The vast majority of our population are vaccinated. There is what's called a carriage rate of the vaccine, of the virus in people who are vaccinated. But because of that, you will see two things. One is you will see that a modest number of people who test positive do actually have vaccine protection. And the vast majority of these are managed at home. We do, however, see a rise in the number of inpatients. And I think it's important to appreciate a couple of things around this. That number is as low as it is because of everyone's hard work with the vaccine and now with the boosters. The vast majority of these people have significant medical challenges independent of COVID-19. And because of our success with vaccination, you would still see some of these people being partly vaccinated. There are, however, only a small number of people within that group who are vaccinated, to the point where it's very difficult for me to provide a breakdown simply because of the risk of unwittingly identifying individuals because of revealing personal health information. And we've said from the get-go that we were not prepared to go down that road. So I think there is both some comfort there because of our vaccine rates, but also a little bit of caution because our hospitalization numbers have crept up. The other thing I wanted to address while I had the opportunity is around the rapid test kits. There seems to be a myth out there that there's some warehouse, like in the movie Indiana Jones, which goes on forever, full of rapid test kits. That is not the case. There is a global shortage, and there is a shortage across Canada. We received 305,000 kits today, and we have already distributed somewhere of the order of 335,000. We keep a small reserve for public health to use in outbreaks. Those kits sound like a lot, but we need around 335,000 kits a month to deal with our policy around schools when they reopen. We need around a similar amount to deal with points of entry. Some days we have 500 visitors, some days we have 1,500, and each of them needs 5. Congregate living facilities are most vulnerable, seniors, assisted living, and these kind of things. We think we are using around 200,000, or will use around 200,000 a month. And then there's daycare. So you can see when you add that up, we're going to be in the process of burning through around 1 million kits a month. We have as yet not received any of the 140 million from the federal government. I spoke with the federal minister recently. He is reluctant to give us any estimate until he knows he can give us a firm date. And I respect that, and it's very helpful. So the kits we have sourced and the kits we are also going to source, we expect another 500,000 over the course of the end of next week. We have sourced independent of the federal chain. So I think it's really important that people realize that these priority groups that we have are only just serviced by the inventory we get. At some point, public health may change their recommendations about frequency and use of rapid antigen tests. But until that happens, we need to make sure we can provide them in the way that we have said as part of the testing plan. So with that, I'll draw my comments to a close, and I'd be happy to hand it over to Nancy for moderating the media. Thank you.
Thank you, Minister. Today we have 5 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Peter Cowan of the CBC. Peter, please go ahead.
Minister, Health Canada today approved a new antiviral for treating COVID from Pfizer. I'm just wondering, how is the province going to be using those, and how many are we expecting to receive?
We have not received the details of the number. We expect that Canada is going to get in about 1 million doses. Our share of that would be 1.4% on population basis, and we will certainly make sure we get that. How it's used will depend on the advice from infectious diseases experts, and is essentially a clinical decision. It won't be a health policy decision. It won't be an administrative decision. It will be the decision of the doctor looking after the patients.
In light of, you were talking about rising hospitalizations, they are still trending actually noticeably lower than the models that we saw last week from Dr. Rahman. In light of the fact that we kind of expected these numbers to rise and that we have about 300 empty beds, as you said last week, aren't we in a position to be able to slowly start to open up, considering case counts have lowered as well?
Yes, we're walking that line, and indeed there will be some public service announcements from regional health authorities over the course of the next day or so, announcing their plans to increase planned services and non-urgent services. We have been extremely fortunate in the sense that the husbandry of beds and resources has allowed us to have a stellar vaccine campaign, and yet at the same time, cancer surgeries, urgent surgeries, chemotherapies, urgent cardiac care, those kind of things have continued, whereas in other jurisdictions they've ground to a halt. But yes, as the opportunity presents itself, we're ready to open up to more planned services.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, and thank you, Minister Haggie. My first question is, what needs to be changed? What do you need to see in the province's epidemiology to move down an alert level next Monday?
I think the discussions in public health are very much about the desire, the urge, as it were, to get children back to school. We know that for their emotional, their educational development, that kind of setting seems to be the best place to engage and to learn. And so I think there will be a move to do that first. And it may well be, given the epidemiology, that we take it in a very slow and steady pace. So in terms of opening up to other things, that might be something we did, for example, after schools. Those discussions are taking place. And I think given the fact that Dr. Fitzgerald will be meeting with modeling teams and the like over the course of the next day or so, that our regular update on Wednesday will be able to address that better than today.
Thank you. And speaking of schools, earlier today, Premier Fury tweeted that 73% of children aged 5 to 11 have gotten their first dose of the vaccine. How important is it to get that number higher for schools to reopen?
I think certainly it's important. I think the challenge is actually accessibility. One of the easiest places to vaccinate children is actually in the school that they go to, which is currently not open. So what we're looking at the moment is booster levels in the support staff and the teachers, for example, to see if that is a good indicator of how wise it is to reopen schools. I mean, we will see further cases as we open up and do more, simply because Omicron is so easily spread. What is very clear from my introduction and from data elsewhere is that in the fully vaccinated, and particularly in the boosted, Omicron is nowhere near as severe as in those who are otherwise chronically ill or unvaccinated. And the vast majority of our Omicron cases, the vast majority, have been managed at home.
Our next questions are from Peter Jackson with The Telegram. Peter, please go ahead.
Good afternoon. Can you tell us how many long-term and personal care homes have reported cases in the province among staff or residents, and have those cases been contained?
That's a very good question. One of the challenges is we have public health suppliers with outbreak data, and that has a particular definition. And the RHAs have an inventory of those personal care and long-term care facilities that actually have cases. I don't have data for all the regional health authorities, but my understanding is that in Eastern Health, for example, there are around 80 facilities which have cases or within staff or within residents. And that includes some acute care facilities, as well as long-term care, as well as congregate living, as well as personal care homes. The data for the other RHAs isn't available yet. It's collected manually, and that's always a bit of a challenge when you've got people trying to do other things at the same time.
Okay, I just want to confirm. You said 80?
80.
Okay. Why would a resident in long-term care with no symptoms have to isolate for 14 full days when that's not the case, say, with a nurse or whatever?
Yeah, I think that question is best addressed to public health. They make those recommendations. The recommendations, though, in long-term care and in personal care homes are different because of the more vulnerable nature of the people in those facilities. There is no doubt that Omicron is a little different in that it tends to have a shorter infectivity period. But I think out of an abundance of caution, that has been the approach that's taken. But I'm sure Dr. Fitzgerald would be better positioned to answer that more fully from a clinical point of view.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. My question is around the timing of our next assessment of the province's alert level. With when we first went into the alert level 4, we set a timeline of about 2 weeks to reassess. Now we're dropping that down to 1. I'm just curious as to why we're deciding to go with the 1 week instead of a 2-week cycle for this time.
I think because if you look at the epidemiology, one of our indicators, which is total case count, is starting to drop. But if you remember, we've actually changed the criteria around that. So we need to be sure that we aren't just lulling ourselves a little bit. And so we have switched emphasis to hospitalizations. The only other comment I'd make here is that alert levels and school opening and closing are not linked. The alert levels below 5 never actually mandated school closure. So that leaves the option of slow and incremental progress if that's the way Dr. Fitzgerald and her advisors interpret the data.
And coming off of your comments at the beginning of this briefing, Minister, about rapid tests, earlier this week, nursing homes in the province were pleading for more rapid tests to be provided to them. Given your comments at the beginning of this briefing, is it possible to increase that allocation at this time?
The number that are provided is based on the recommendations from public health about their testing plan and about how frequently workers there should test. There is science behind that, and that's what our numbers are based on. We will struggle, but we will provide them with that. If we had them, we'd give you them. But at the moment, we've got to be careful that we leave ourselves a little pile in case of an outbreak somewhere where public health would find them incredibly useful, and also deal with schools and daycares and points of entry. These are test kits that are in global demand, and there is a global shortage.
Our next questions are from Ronelle Legros with All Newfoundland Labrador. Please go ahead, Ronelle.
Minister, I think it's safe to say that everyone is tired of restrictions, but have any issues with violators of the regulations this time around?
I've not been made aware of any enforcement issues specifically, or at least in terms of a frequency that's raised itself to my level. I think if you wanted more lower level, granular operational detail, then obviously RNC, RCMP Service NL, NLC, those would be agencies that would be able to give you a lot more information about how many calls they get and that kind of thing.
Minister, do we have anyone here locally manufacturing the rapid test kits, or is there an option there for government to work with somebody locally to manufacture these?
I'm not aware that that technology exists in the province. It's a very good question. We've certainly tried to do things locally from the point of PPE where we could, and have had some modest success in that regard. And I recall the efforts of Task Force NL, among others, back in Premier Ball's time. These are fairly complex pieces of equipment, even though they're simple to use. The technology behind them doesn't exist in the province at the moment.
I'll now go back through each reporter to see if you have one final question. Peter Cowan of the CBC, do you have a final question today?
I do. With the antiviral drugs, you said it's a clinical decision, but we know that these drugs need to be given within 3 to 5 days of symptom onset. And we know that most people, they're going to be at home. They're not going to be under the care of a doctor. So what's the plan to make sure that, especially those, for example, 80 plus, who Health Canada have said should be receiving these, are actually able to get those drugs quickly so that it has the opportunity to reduce those severe health outcomes?
Yeah, well, those will be prescribed by a practitioner. They will be available in the province, and the college presumably would issue guidelines to their practitioners on the basis of best practice. That's a clinical practice issue, and it's really not one that the department would be able to opine on. It's not our field of work.
Ben Cleary of NTV, do you have a final question?
Thank you, I do. Minister Haggie, is there an update today on how many healthcare workers are in isolation throughout the province?
I do have that number as of this morning. It's 826.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Yes, sorry, I do. I just wanted to confirm, you've mentioned daycares now a couple of times when it comes to rapid tests. Are they actually routinely testing now, as was requested earlier when you did the school opening?
My understanding is that we've allocated notionally 60,000 tests a month for daycares. I would have to go back to the department staff and find out whether those have been delivered for distribution or whether they've been received. I honestly wouldn't know just at this particular moment.
Okay, thanks.
Richard Duggan of VOCM, do you have a final question today?
Yes, I do. Minister Haggie, back in June, public health officials were investigating a possible case of myocarditis in the province and its potential link to vaccination. In the time since then, has the province identified any more cases of myocarditis in the province?
Not that I'm aware of. Again, that would be a question better directed perhaps to Dr. Fitzgerald. Public health are the ones that receive the summary of adverse events. We have a formalized provincial system for notifying those. So I'm certain that we could go back and ask them that question for you.
And Renelle Legros of All Newfoundland Labrador, do you have a final question?
Yes, thanks. Mister, I'm just wondering if the province has now received all of the swabs back that were sent out of province for testing.
My understanding is that we have not had any sent back over the course of the weekend. Whether or not there are still any of Eastern Health's last tranche, I would be surprised because of the time, but I can certainly go back and check.
Thank you, everyone. Minister, do you have any final comments today?
Yes, just briefly, I think it all goes back to vaccination and the boosters. We have now emerging and very clear evidence that being fully vaccinated reduces your risk of getting serious or even moderate symptoms from Omicron by as much as 90%. And the booster on top of that builds even further. Get the shot. It's your best protection for you. It's your best protection for everyone else. Stay safe.
Thank you, everyone, for joining us.
Most of that with a saw. Wouldn't that be nice? And then just have to plane a little bit down. So I've got lots of leeway here. I can even stay a 1/16 to an 1/8 of an inch away from my line. Just give it a try. Gotta have a perfectly, because this is a fairly long cut, so we need to make sure we're perfectly straight. Okay, now for fitting this top, I have most of it done, so I milled it down to close to the thickness we wanted, and then I had to start taking out the sides, or taking in the sides, sorry. So you need to have a perfect flush back face here for testing, and then it's just a matter of keep milling with a hand plane, little bit by little bit, until you get the fit you want. So right now, you can see we have, it squeezes all the way in, tons of friction, will never come out, but we have a nice, perfect line here. And now all our cutting, fitting, designing, and cobbling up is done. And hopefully you have a box that you're happy with. I'm pretty happy with this one. There are a few things I'd change probably in the future, but now we're at my favorite part, which is adding a little bit of oil to the project. And that really makes the wood kind of come alive a little bit, look a little more rich. Woodworking is a hobby that I really enjoy, and I've been dabbling in it since I was just a little kid up in Pop's garage, and he used to let me play around on the scroll saw or with a hammer and nails and that type of thing. I've come a little way since then, not too far, but it's definitely something I enjoy. Every time I get to woodwork, it's always a treat. Hand tool woodworking like this is such a relaxing hobby, and it's something you don't need a lot of space or money to do. Materials are cheap, a piece of pine is so cheap, and you can build so much with it. You just really kind of have fun with it, and it's definitely a beautiful hobby to get into. My skills, like I said, aren't top notch, and I haven't been woodworking for a little while, so I even found myself a little bit rusty at this project. That's kind of what happens though with your hobbies sometimes, is you move on to new hobbies, or you push some aside because you're busy and you'll lose a few skills, but that's okay. They can always come back with a little effort. That is it for another project, our handcrafted pine box that's going to store this custom knife. I really hope that the owner, customer here, is happy. I know I'm happy with the results. To me it looks really beautiful, elegant. The box is nice and simple, so it doesn't overpower the knife. The knife is still the star of this project. I'm really happy with it. I hope you guys learned something in this project. Like I said, this is a small little box, but you can build this exact same box, this exact same design, and scale it up however big you want it. This would be beautiful for tool storage. I've built a couple of these now to store some of my combination planes that are really odd shapes, so they need kind of their own storage place. This is great for that type of thing, or like I said, to make a jewelry box or something. I hope you learned something. I hope you learn that this can be done, projects like this, with very minimal tooling. Even some of the tools that I use here, like the router plane and some of the specialty tools, I use them more for fun. I didn't need to use them. I gave you ways that you could have got around it, did the same work with cheaper and more basic tools. So I hope you pulled that from this video. At minimum, I hope you were entertained. Thank you guys for watching. I want to give a huge shout out to my sponsors. If you guys can, go ahead and support my sponsors. They really help me produce this show. That's it for this week. Make sure you tune in to the next episode of the Newfoundland Hobbyist.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
If you have a comment about this program, we'd love to hear it. Email or call us or send us your feedback through social media.
Hi, I'm Carl Wells, getting ready to record another edition of Carl Wells Point to Point. It's a program where I chat with members of our community and they talk candidly about their lives and careers, from their earliest dreams to their greatest triumphs. I think you'll find it informative and entertaining. Please join us for Carl Wells Point to Point, right here on Rogers TV.
Yo. Yep. Okay, I'll be there. Hey everybody, what's up? It's your boy DC, and I am the Thursday night host of St. John's local tradition, Out of the Fog. You know, local matters here on the show, and from arts and business, not-for-profit, anybody doing anything great to make our province a more rewarding place to live and work. It all happens right here in the studio. So join me and my boy DJ Slim Macho every Thursday night for Out of the Fog.
This is Rogers TV. Enjoy Stingray music free on your mobile.